important. You know, Mr. President, we talk about the number of people uninsured. Very important number, 46 million. But we don't talk about the number of people who every day do not have access to a physician or a dentist on a regular basis. And that number is close to 60 million. These are people, when they get sick, can't find a doctor. Where do they go? Well, several things happen. They may end up going to the emergency room, which is the most expensive form of primary health care that we have. That's where they go. Or even worse, they don't go to any doctor at all. And what happens is they get sicker and sicker, then they go stumbling into a doctor's office, and the doctor says, "Why didn't you come in here 6 months ago?" And the person, "I didn't have any health insurance, couldn't afford it." And they go to the hospital, and we spend tens and tens of thousands of dollars treating somebody who is now suffering in a way they should not have suffered, at greater expense to the system that should have been the case. Now, what sense does that make? And let me tell you the worst-case scenario. The worst-case scenario is they walk into the doctor's office, and the doctor says, "It's too late. Can't help you anymore. You should have been in here 6 months ago." I have talked to physicians who have told me about that. I suspect you have as well. And that is why this year we're going to see 45,000 of our fellow Americans die because they don't have health insurance and they don't get to the doctor when they should. Now, one of the advantages of the community health care program is that it is an enormously cost-effective program. One study recently reported that $20 billion is wasted every year in this country in unnecessary and inappropriate use of hospital emergency rooms for non-emergency care. Now, when you walk into an emergency room, I don't know about West Virginia, but in Vermont it's about $600. If you get that similar care for a non-emergency type ailment, the cost is $100. So think about all of the money that we save when we have community health centers expanding all over the country. Now, one of the issues that we have not focused on enough, in my view, in this whole health care debate is the very serious crisis in primary health care in general. The American College of Physicians, in a recent report, warned that the nation's primary care workforce, which it called, quote, "the backbone of our health care system," is, in its own words, on the verge of collapse. That is the American College of Physicians. Over the past 8 years, for example, the number of family practice residents fell 22%, while the overall number of medical residents rose 10%. Currently, and this is an extraordinarily frightening statistic, only 2% of medical students interested in internal medicine intend to pursue primary care as their specialty, 2%. This growing crisis was recently underscored in a report by the Association of Academic Health Centers, which warned that the country is rapidly running, quote, "out of time to address what is out of order in our health workforce," end of quote. Now, the good news is that 20 million of those people who live in medically underserved areas are fortunate to live where there are federally qualified community health centers. And let me explain a bit. What is a federally qualified health center, which exists in all of our states, 50 states? It is a center which says that if you have no health insurance, you can walk in. And you know what? You will pay not only for primary health care, but for dental care, which is a huge problem all over this country. For mental health counseling, you'll get the lowest cost prescription drugs available in America, and if you don't have any health insurance, you get it on a sliding scale basis. If you got Medicaid, you are welcome into the center. If you got Medicare, you're welcome. If you have private health insurance, you are welcome into these centers. Currently, these centers serve 20 million Americans in all of our 50 states. Conceived in 1965 as a bold new experiment in the delivery of preventative and primary health care services to our nation's most vulnerable people and communities, community health centers are an enduring model of primary care for the country and are designed to empower communities to create locally tailored solutions that improve access to care and the health of those they serve. West Virginia centers will be different than Vermont centers, will be different than California centers, because they are designed and locally controlled to serve the needs of the local population. By mission and mandate, community health centers must see all those who seek their care, regardless of health status, income level, or insurance status. If you're rich, if you're poor, you will gain access to these community centers. Nobody is tossed away. Today, these health centers are America's health care home to 1 out of every 4 low-income uninsured individuals, 1 out of every 6 rural Americans, as well as 1 out of every 7 Medicaid beneficiaries and 1 in 4 low-income people of color. We need to guarantee that as we expand coverage, we expand community health centers as well. They are the one primary care provider who will see those on Medicaid without restrictions. Furthermore, community health centers already employ so many of the features of what we seek in the medical home model. They provide integrated health care, which is what we're talking about. A study recently by George Washington University. We're talking about spending money. What is so exciting about this whole concept is you're going to create more health care opportunities for people, and you save money by keeping them out of the emergency room and out of the hospital. A study by George Washington University found that patients using health centers have annual overall medical care costs that are more than $1,000 lower than those who do not use a health center. $1,000. That translated to more than $24 billion in savings for the health care system last year alone. We are keeping people out of the emergency room, we're keeping people out of hospitals, and we're keeping them from getting sicker than they otherwise would have. And, Mr. President, that is why I'm so pleased that Majority Leader Reid has looked at this track record and concurred that we will guarantee the funding of health centers over the next 5 years in order to provide health care to more people and to save money at the same time. Now, let me tell you in concrete terms what $14 billion, the amount of money that's in the House, what this will mean to the American people. What it will do is will increase the number of people who have access to community health centers from the current 20 million to 45 million over a 5-year period. 20 million to 45 million. We are more than doubling the number of people who will be able to walk into a clinic, health care, dental care, low-cost prescription drugs, primary health care. In 5 years, going from 20 to 45 million people. Mr. President, this funding would create new or expanded health centers in an additional 10,000 communities. 10,000 communities from one end of our country to the other. In some cases, entirely new federally qualified health centers would be established. In other cases, new satellite centers would be created. In Vermont, for example, we have 8 community health centers. We have 40 total sites. And that is true all over this country. But, Mr. President, can you imagine that in the United States of America, within a 5-year period, 10,000 new community health centers in this country would be established? People would not have to go 50 or 100 miles to find access to health care. It would be there in their own community. It would be in urban areas, in rural areas. This is extraordinary. Now, these community health centers and the growth of these community health centers don't mean much unless we have the medical personnel to adequately staff them. And as I mentioned a moment ago, everybody concludes we have a real crisis in terms of access to primary health care in this country and the number of physicians and dentists and nurses that serve in the primary care area. What this language does that we have just added is it would, if we adopt the House numbers, triple funding in a 5-year period for the National Health Service Corps, which provides loan repayments and scholarships to medical students. In the University of Vermont Medical School, my memory is correct, and this is fairly typical for America, the average medical school student graduates with $150,000 in debt. Well, if you're graduating with $150,000 in debt, what are you going to do? You're not going to do primary health care. You're going to go into some fancy specialty and start making a whole lot of money to pay off that debt. But what the National Health Service Corps will be able to do is provide debt forgiveness and scholarships for an additional 20,000 primary care doctors, dentists, and nurses. That is a lot of new medical personnel that's going to get out into underserved areas all over America. And that is just a very, very exciting thought. Mr. President, in short, when we more than double in 5 years the number of people who have access to community health centers, and within that same period of time we add an additional 20,000 primary health care doctors, dentists, and nurses, we are talking about nothing less than a revolution in primary health care in America, something which we have needed for a long, long time. So let me conclude, Mr. President, by just saying this. I want to again thank the Majority Leader, Senator Reid. I want to thank Senator Durbin, Senator Schumer, Senator Murray, and thank you and the Democratic leadership for your support of this concept. As you know, this idea developed back in the 1960s with Senator Ted Kennedy, who developed this concept in the first place. It has expanded, and now we are going to take it a giant step forward, and in the process, I think